Good morning or good afternoon. Welcome to the National Consortium of Telehealth Resource Centers Telehealth Hack Series. My name is May Kwong. I'm the Executive Director at the Center for Connected Health Policy. Next slide, please. The NCTRC Telehealth Hack Data Series, we will be collecting some of your data from your registration. Please know that we will keep this confidential. It will be de-identified. It is only for certain reporting purposes that we have to the federal government. Next slide, please. The National Consortium of Telehealth Resource Centers is made up of the 14 telehealth resource centers who are funded through a grant from HRSA. There are 12 regional resource centers that cover specific states, and there are 2 national centers, one on policy, which is CCHP, and one on technology, TTAC, who you'll be hearing from on today's webinar. Next slide, please. For those of you who have attended the telehealth hacks, you realize they were under the Assistant Secretary for Preparedness and Response. They have now transitioned over to the National Consortium of Telehealth Resource Centers. We will be continuing the series through March of 2021, and we hope you'll be able to attend each and every one of them as we think you will find the information useful for your transition into utilizing telehealth for your practices. Next slide, please. A couple of housekeeping items. Please note that your phone and computer microphones have been muted. If you have a question for our speakers today, please use the Q&A function. The chat function is only for technology issues that you may need or have questions about regarding Zoom. Also know that this webinar is being recorded today. The recording will be posted within about 24 hours to our website and our YouTube channel, and those are the links on where you can find the recording. Next slide, please. Today's agenda, we'll be hearing from, as I mentioned earlier, the Technology Resource Center. They'll be talking about technology trends for today, telehealth. We'll hear from Doris Barta, the Director of TTAC, and Jordan Berg, the Telehealth Technology Specialist. Our session today will be moderated by Dr. Christian Reimers. Next slide, please. Dr. Reimers is the Chief of Population Health and Director of Graduate Medical Education at the Family Health Centers of San Diego, a large federally qualified health system serving nearly 200,000 medically underserved individuals throughout San Diego County. He is board certified in internal medicine, infectious diseases, and addiction medicine, and is particularly interested in HIV, HBV, HCV, and service of medically underserved immigrant and refugee populations. I'll now turn it over to Dr. Reimers.
Thank you so much, May, and thanks to everyone who's here and those of you who have continued on from the first Telemedicine Hack series and those that are joining anew. We'd like to create a really nice, welcoming educational environment and look forward to very good discussion. I'm going to be introducing our speakers in just a minute. Just 1 or 2 things additionally I want to say. Please use the Q&A on the bottom. We want to formally acknowledge the questions that come in. And we actually have May is going to volunteer to be our ghost panelist today, and she's happy to answer your questions as they filter in there as well. And then if you're having any technical difficulties, feel free to use the chat for that as well. If you do put questions in the chat, we'll advise you to hopefully put those in the Q&A as well. And we'd like to create an open educational environment and try to make this as non-commercial and non-political as possible. So please adhere to those guidelines. So do we have a next slide, or maybe we could take the slides? There we go. So I'm happy to introduce our 2 speakers today. So we have Doris Barta and Jordan Berg. Doris is the Director of the National Telehealth Technology Assessment Center. She brings over 20 years experience working in the telehealth field, serving in the capacity of a telehealth network director, as well as the role of fund development for telehealth. And has also worked as a principal investigator for the Northwest Telehealth Resource Center for the past 10 years. We also have Jordan Berg. He's the Technology Assessment Specialist at the National Telehealth Technology Assessment and Resource Center, which we call TTAC. You'll hear TTAC and TRC. TTAC is one of the 2 National Telehealth Resource Centers. Jordan has over a decade of hands-on experience working with the Alaska Tribal Health System and 6 years of experience working in telemedicine. So we have a really exciting and kind of broad survey topic today. That'll be a nice introduction into this series, and I'd like to turn it over to Doris to begin our talk.
Okay, thank you very much, Dr. Reimers. Ray, can you stop sharing so I can share my screen? Thank you. So, Jordan and I are excited about being able to present to you on telehealth technology trends and what we have seen over the last few years, but also most specifically what we have seen since March and with the COVID-19 crisis and how that has affected telehealth in general. So May shared with you, Dr. Ramers and May shared with you a little bit about who TTAC is. As May said, we are federally funded. We are one of the 2 national TRCs, and primarily what TTAC does is provide technical assessment services to the 12 regional TRCs as well as the other national TRC. So we have 3 staff. We have Garrett looking into Jordan's eye there. Garrett is the PI, Jordan is our tech specialist. And between the 3 of us, we have over 50 years experience in the telehealth arena. So what does TTAC do? TTAC provides a lot of educational content on our webpage. We have toolkits on our webpage that can help you as you're making your choices with regards to telemedicine technology. We also provide telehealth showcases at the regional conferences. Now this year we haven't been able to come out to conferences in person, but generally we will bring the technology to you so that you can trial the technology side by side, looking at various medical peripheral equipments, and we provide information to you about that technology. Because we are federally funded, we're vendor neutral. So basically we will share with you the information about the technology so that you can make an informed decision about how you implement your telemedicine program. As May said, we're members of the National Consortium of Telehealth Resource Centers. All of the TRCs provide information that is put on the national website. And so if you're looking to either expand your telemedicine program or build a new telemedicine program, please take advantage of the resources that are available to you on the NCTRC website at www.telehealthresourcecenter.org. So this is the interactive map that is actually on our NCTRC website. So if you are from a region, all you have to do is click onto that region, and that map will drive you to the information about that TRC. So if you are interested in finding out information about one of the 2 national TRCs, all you have to do is click on to that icon and it'll drive you to either TTAC or CCHP. So what are we going to talk with you about today? Today, what we would like to discuss with you are trends in web-based video platforms that are being used to deliver patient care. We will be looking at some of the key considerations that the individuals and organizations are needing to make when securing a platform. This also includes security and privacy issues telehealth providers are having to navigate. We will discuss some general trends that we found in a recent assessment we performed on common video platforms. We will be talking about broadband connectivity in the United States, and most specifically, how that is affecting rural patient areas. We will be discussing technology and user considerations for providers and patients. And finally, we will leave you with some practical thoughts as you continue to make your technology decisions related to COVID and in technology as in general. So let's talk a little bit about what some of the platform trends are that we are seeing. Because of COVID-19, we have had an increased interest in using telemedicine to provide patient care. Organizations are wanting to get up new telemedicine functionality as quickly as possible, and there is an increase in interest in providing services to the patient in their home environment. So with regards to web-based, COVID has brought web-based platform quickly to the forefront of telemedicine. Although we've seen a general trend towards that anyway, because web-based is easy to use, that traffic has significantly increased because of COVID. We've also seen a rapid increase in the desire to provide services to the patient in their home environment. That means we are using the patient's equipment. such as their tablets, their smartphones, and their consumer-grade Wi-Fi, and their mobile networks. It also means that we are using platforms that are connecting with the patients, that are using simple connectivity methods like email, text message, or even through a patient portal. We've also seen an increase in desire to use mobile platforms. This can include technology that is designed to be used on a tablet or a cell phone. So later in this presentation, Jordan is going to provide you with some hands-on demonstration of some of these mobile platforms that have been designed for use specifically for tablets or cell phones. We're also seeing a real increase in desire to use link-based systems that don't require you to download an app to their device. So this could be like logging into a meeting invite for your clinical encounter. So primarily, people are not wanting, excuse me, to download something that is going to use up memory on their device. But although these are convenient, they really don't provide the robust video that is required in a rural environment. And the other thing that we are seeing is a real movement towards general platform devices in general that can be used for your administrative, your clinical, and your educational uses. So people are not wanting to use one kind of platform for administrative use and another kind of platform for clinical use. They really want a system that allows them to be able to use it for whatever their functionality needs are. So as we look into telemedicine platform trends, what are some of the things that we need to be looking at? First of all, we need to be looking at deployability. How quickly can this service or expanded service be deployed in your clinical environment? If you are purchasing a new platform or device, how soon will they be able to use it for patient care? And scalability. How fast can you scale up this new system to provide the level of use that is currently being needed? So if you've been seeing just a few patients a week, how fast can you scale up to over 100 patients a week, which quite honestly is what we have seen with the COVID crisis. Does your network support this spike in traffic? And do you have enough software licenses to cover this spike in demand? How reliable is this new service or device, and how soon can you actually use it for patient care? And in ease of use. As we have more and more providers and patients entering into this telemedicine arena, how easy can they use this system? How easily can you train them in using this technology? So it's vital in the development of providing this care that we don't get bogged down in the technology issues. And in all of that, then, we have to continually be thinking about security and privacy in delivering patient care. So currently, we are seeing two forces affecting security and privacy that are addressing telemedicine concerns. First of all, we're seeing a relaxation of HIPAA compliance and other regulations around the platforms that you are using in delivering patient care. This has allowed the clinicians to connect and be reimbursed using non-traditional technologies. For example, the Office of Civil Rights published a notice about the types of technologies that are and are not appropriate for telemedicine care. So they specifically mentioned FaceTime, Facebook Messenger, Google Hangouts, Zoom, and Skype as potential platforms, although they did admit that these aren't, that isn't an exhaustive list. But they also mentioned some platforms that should not be used, like Facebook Live, Twitch, and TikTok. So as a rule of thumb, if the platform is designed primarily for broadcast or one-to-many communications, it's not a viable telemedicine platform under the discretionary notice. Now, another thing we want to visit with you about is that we realize that the relaxation of the privacy rules is temporary. And so programs really need to adjust their care to more secure platforms. The other issue that we are seeing is concerns regarding the relationship of the service with the provider and the vendor. So some of these concerns actually may be around the user not understanding the security tools that have put in place to the technology that they're using. Or there may be telehealth providers who have not established effective procedures and controls for their video conferencing. Other issues that we are seeing is how is the vendor handling your data? So regardless, we are seeing growing pains as organizations, vendors, and consumers deal with these new ways of seeking and delivering care. So next, what we would like to show you is a recent assessment of web-based video platforms that TTAC conducted. This is a short video that will give you a glimpse into some of our results. And then afterwards, Jordan is going to talk about how we conducted the assessment and share with you some key trends in the video platform space. Oops, let me see. Come on. Why isn't it showing? Well, Jordan, our video isn't showing.
Okay, so and I would encourage you to go to our website, telehealth technology telehealthtechnology.org. On that site, you can actually get links to 2 YouTube videos. One was going to be the video we're showing you today, and one's a little longer and goes into each one. And what we did was we looked at 8 common web-based video platforms, and we kind of put them through a little bit of a broadband torture test. And we did this by using kind of what we see in this diagram here. So we used a network emulator to simulate a variety of different connection limitations that you might see in a rural or an underserved community. The primary one that we were really interested in seeing how these platforms would perform under was speed. So using that network emulator, we were able to crank down the speeds, the throughput that these video platforms could use to simulate what a overtaxed network might look like in a rural area. The other things that we were able to do was to add packet loss and to add delay. Delay is something that we might see for satellites that might connect over, or for communities that might connect over a satellite. Packet loss is something that happens on very highly congested networks where there's not enough kind of bandwidth for the community. So this really, our plan for this was just to kind of simulate how will these platforms really perform in these kind of rural and underserved areas. Our criteria for assessing these devices were around the 4 elements there on the right. The primary one, or one of the primary ones we wanted to look at was connectivity. We were interested in how well do these platforms connect? How long do they take to connect? How easy are they to connect? Once they are connected, how stable is that connection over time? We also wanted to look at video quality. What do these videos look like? Is the image clear? Are we able to see the participants? Do things look jerky or blurry? Audio quality, we assess this by mainly listening to what we heard. Is the speaker intelligible? Is there any kind of noticeable artifact in the audio? Is there a hiss? Is there too much sibilance or not enough sibilance? So we wanted to really gauge how well we could hear what the other participant was saying. And the last criteria was just basic usability and overall experience. Was one of these platforms a lot easier to use? Were some of them a lot more challenging to use? This kind of breaks down a little bit of what we did. We're going to look at a few more details here on the next slide. So again, we looked at 8 common video platforms. We tested them at a variety of speeds, all the way from 100 megabits per second, which is kind of a broadband speeds for an organization. You might see 100 megabits per second, all the way down to 256 kilobits per second, which is very, very slow. It was a real torture test for a lot of these platforms. We had several different test sets that we ran through, just kind of a basic clean test set that was just to measure how much these platforms would kind of use if they were a little bit unrestricted, or if the only restriction was speed. We looked at a satellite test where we added some delay to kind of simulate those packets moving from the Earth to a satellite and then back down. We simulated a satellite where there was an issue not only with a satellite, but some variability and some packet loss. So kind of a poor satellite connection and then just a very poor connection. So we wanted to run them through all of these different platforms, all these different torture tests, and then kind of see how they did, what the results were. And we want to go over at a high level some of those results on the next slide here. So one of the things is we've been talking to people about this. One of the things that we find is helpful is to give you a little bit of a reference. So if I say 3 megabits per second is what most of these platforms want to consume in terms of download speed, that may not mean a whole lot to you. But what we can actually use as an analog for this is 3 megabits per second is about what we can expect of a Netflix video. So if you're using Netflix to watch a video at standard definition, the download speed that you need for that is about 3 megabits per second. If you're wanting to watch an HD video, that's about 5 megabits per second. So that kind of helps us anchor our expectations as we're talking a little bit about these bandwidth things. So with that kind of in the back of our minds, what were some of the challenges that we saw these platforms have? One was around connectivity in general. So if we were most of these platforms connected through web browsers and kind of over the internet, and even on unrestricted networks where they were given their full the full 100 megabits per second so that they could use that. Most of these platforms would use about 3 megabits per second, about that Netflix amount of speed to download, and then about 2 megabits per second upload. But even at unrestricted networks, we found that most of these platforms took about 30 seconds to connect. So when both participants hit the connect call button on either side, we could expect about 30 seconds before both participants were in the call, able to see and hear each other clearly. Once we started to add network degradation, we reduced those speeds, we added packet loss, that number went up pretty significantly. So that's a big challenge that a lot of these platforms have, is that if you're connecting through a web browser and you have 2 endpoints connecting via a web browser, if you have any kind of network instability, it may take a long time for those 2 participants to be able to get into the call. Another issue that we saw was around those poor quality networks specifically. As soon as you, even for speeds that were good, 3 megabits per second, 5 megabits per second, the minute we started introducing packet loss or other network artifacts, we started to notice a pretty significant degradation in both the video and audio on both ends of the call. So it's not just speed that we have to be concerned about as we're reaching out to our patients, it's also what the quality of these networks are. The third big challenge that we saw with these was, as Dora said, there's a big move towards clientless solutions. So solutions where you just send a patient a link, they join via a web browser, there's no installs, there's no app, there's nothing that you have to do to get these connections to work. But we found that those sorts of connections were more likely to be impacted by low bandwidth and poor quality connections than a desktop solution. So something that you download, you install on your computer, and then you have 2 people joining in, logging in and joining in from those 2 pieces of software. So in general, what this means is that if you're joining over a browser or you're joining over a phone without an app solution, you probably will have a little bit less of a less quality on low bandwidth situations. So how do these different platforms deal in general with these low bandwidths? Well, there's some commonalities and some differences between these. In general, the biggest commonality is almost all these platforms will really focus on prioritizing audio over video. So what that means is that when you're on a call and the bandwidth drops and you're getting less throughput on the bandwidth, your audio is going to be preserved, and you should be able to hear audio in most cases well after you're starting to see a significant degradation in the video. So the video may look very, very poor, but the audio should still be coming through nice and clear. And we found in all the platforms that we test that to one degree or another, they were doing this kind of audio prioritization, especially for platforms that were just running over the internet. So web-based, WebRTC platforms particularly, they were more likely to prioritize that web audio than they were the video. So the video would look very, very poor, but the audio would still be pretty clear. Another common strategy that we saw for dealing with this was let's make the video smaller. And how do we make the video smaller? Well, we're going to do that in one of two ways. We're either going to reduce the resolution so everything looks kind of blurry and chunky. And we've all kind of seen this in the different video calls that we've been on. You see people look really pixelated and things like that. The other way that they address it is they drop frame rate. And what that means is the image may still look clear, but it's going to start to look jerky. It's going to start to look like an old time movie where you don't have as much information being shown in those pictures from image to image to image. So it almost starts to look a little stop motion. If it gets really bad, you'll hear people describe it as a slideshow, right? So you have that kind of slideshow effect where the images jerk from slide to slide to slide. So those are the kind of two ways they reduce the bandwidth from the video. The final way that these platforms deal with with low bandwidth is to kind of push you towards the client. So you'll see this even on these web-based platforms. If you're in a web-based platform and it's noticing that you're having connectivity issue, it'll recommend that you download their application, or it'll recommend that you download their desktop client so that they have more control over what's happening on that connection. Again, those clientless and mobile solutions tend to not perform as well in low bandwidth situations. So a lot of times these platforms themselves will recommend that you choose their downloaded client-based solution. So in general, with the things that we found that were most impactful to the audio and video quality was the bandwidth, but probably even more than that was the packet loss and the delay that we saw as we kind of introduced those. Even on good network connectivities, we saw that if you introduced even a little bit of packet loss into the call, the audio and video quality suffered pretty dramatically, again, even on high bandwidth connections. So what that means to us is that it's not just the speed, it's also the quality. So we need to make sure that when we're connecting with the patients, we have good quality and good speed connectivity to their homes. And that leads us to kind of a conversation about broadband in the US. And the big kind of bullet point here is where historically in telemedicine, we've been concerned about getting good connectivity to the clinic, to the rural clinic in these areas. Well, we're having to take a step beyond that and be focused on getting good connectivity to the patient home, because that's where the patient is, that's where we can expect to see them. It's adding a whole other layer of complexity to already a pretty complex situation that we were dealing with. The good news is that kind of at a nationwide level, the United States bandwidth, United States bandwidth infrastructure has dealt fairly well with COVID to this point. We've seen a 30% spike in traffic from pre-COVID to post-COVID. And in general, we've seen across the board some slight speed reductions, but in most cases it was pretty regional and minimal. What the issue, what we've seen kind of from internet service providers is the FCC put out a call for internet service providers to join on to the Keep Americans Connected pledge. And what this was a promise from these internet service providers that they wouldn't terminate service due to unpayment. They would waive late fees, and they would open up as much access to public Wi-Fi spots as possible. A lot of these internet service providers went beyond that to boost data caps, to get rid of throttling speeds. But what we found is that pledge ended at the end of June. So June 30th is when that pledge ended. And after that, we've been hearing anecdotally a lot more complaints from the consumer advocacy groups, and from Freedom of Information Acts are reporting that we're seeing a lot more complaints about internet service providers actually delivering kind of what they promised from that from the Keep America Connected pledge. And so most of this is anecdotal at this point. We don't have a whole lot of hard information on what patients are actually getting at these endpoints, but it's something that we want to keep an eye on. The two key issues around these broadband connectivities, one is a matter of infrastructure. For some of these rural and underserved locations, they just don't have the infrastructure that comes to their community that's going to give them access to that broadband speed. That's really improved within the last several years, but it's still a key issue. The other issue, and a potentially more impactful issue, is around access and price. So if you can't afford the broadband speed internet that you need to get good good telemedicine, that really is a limiting factor to people that can actually get access to these services. And what else we see is that this is particularly pronounced in rural and tribal locations. So in 2018, the FCC did a broadband study, found that 24 million Americans still lacked access to broadband speed internet. Of that 24 million Americans, 80% of them were in locations denoted as rural or underserved, or tribal. And so we can see that there's a whole population of our communities that are really lagging behind, or being held behind in access to good quality broadband. And this crisis has shown how important that really is in any kind of emergency, a national-wide emergency. We need to be able to connect to these people. We need to be able to have them connect to the services that they need. So next, we're going to have Doris talk about some of the technologies that we're using to connect to our patients in their homes, from our homes, and in different ways.
Oh, thank you, Jordan. So one of the things that TTAC has been tracking is a trend in video conferencing equipment. We've seen a lot of the providers moving towards web-based USB plug-and-play systems. We talked with you a little bit about that. And primarily that's because we're more of a mobile community now. We can provide services on our laptops, we can provide services on our tablets, and even sometimes we're providing services on cell phones. And so because we have moved more into a mobile environment, we also need to use technology that is more user-friendly in that mobile environment. So video and audio solutions that use USB peripherals are becoming more important to the providers as they want to enhance their interaction with their patients. So as we are discussing this technology, Jordan is going to be demonstrating some of this technology for you. But you know, all of our computers now, or the majority of our computers, have built-in audio and video solutions. But what we are seeing as we continue to build out telehealth technology is that our providers and our patients, quite honestly, are wanting to see a better audio and video solution capability, a clearer, crisper picture, clearer audio capability. So at this point, I'm going to stop sharing the screen, and we are going to actually provide you with a demonstration of some of the technologies that are available in the audio and visual space.
Thanks, Doris. So we're going to look at some audio solutions first. And if you've been kind of looking in the telemedicine space for a while, you're going to be fairly familiar with these two form factors. And we're finding that these two form factors are probably the most common ones that are being used for telemedicine. Some sort of speaker puck with a built-in audio and microphone solution built into one USB plug-and-play type of device. And this is probably a little bit even more prevalent right now, is a headset solution, something with a boom mic and audio that or ear cups that will go over ears. For folks that don't have access, especially for providers that are working from home and don't have access to kind of the office setting that they're used to, solutions like this really help make sure that the audio that's coming through is only the audio that you want to come through. So if you've got kids studying in the next room, or you've got a dog barking a little bit down the street, we can make sure that our patients are hearing kind of what we want them to hear. The advantages to solutions like this, one of the things that we find is audio is often one of the most commonly overlooked parts of a telemedicine call. And we also find that if we're talking kind of sheer bang for the buck in improving our telemedicine experience, audio is really one of the first places that we should look at. There's something about the human voice, and being able to recreate the human voice very accurately helps us to build that rapport with our patients that we really need. So investing a little bit of money in an audio solution can really help us move our telemedicine programs forward in a really dynamic way.
So Jordan, if I'm a provider, a couple of questions. How important is it for the provider to be involved in the selection of that audio solution. And when you're talking about, you know, the cost for that, what are we really looking at?
Sure. Well, let me handle the cost part first. So most of these solutions are going to run anywhere from about $60 to $150. So in terms of hardware, there's not a whole lot of, not a ton of cost there. So they're fairly affordable. And one of the things that we're finding is we need to have solutions that if we're having providers working from home and seeing patients from home, that we can just send to them and they can plug in and make go themselves. So it's not, we're not going to be able to have IT support go out to people in their home or even into people's offices to be able to plug these in, make sure all the USB drivers are loaded and things like that. We need to make sure that, you know, whatever technologies we're using are kind of plug and play and easy to use. It's also really valuable to have your providers try these out, you know, either in a meeting or in a safe situation before we have them. We expect them to use these with patients. So making sure that we get a chance to try these solutions before we're actually delivering healthcare with them is really valuable, and getting provider input on that on the front end can save you a lot of headache. The next solutions that we want to look at are webcams. We're all familiar with webcams. We've seen them. We see they get used. What I have here is two kind of webcams. This is one of the ones we see pretty much all the time. This is a Logitech webcam that's very, very common. This is an older one that's probably 3 or 4 years old, but this device right here will still get you better video performance than what you might see out of the connectivity on your laptop. So the laptop cameras, the little camera inside of your laptop, a lot of providers are still using those. You have a very narrow field of view. You have generally poor color representation, poor depth of field. So upgrading, again, around price, these are between $60 and $120 for most of these webcams. Even a modest investment in a basic webcam is going to give you quite a substantial performance improvement over what you normally get out of your laptop, the built-in solutions on your laptop.
So as you're choosing video solutions, I know that one of the issues that I've had in rural areas is I actually have a high def video, and sometimes that takes up too much of my bandwidth, you know, as we've talked about. So is there a way that you can maybe change that resolution on your camera to maybe help you to have a better video presentation?
Well, some of the good news is, as we kind of talked about in our broadband discussion or in our video comparison discussion, is a lot of the platforms are doing this automatically. So they'll reduce the resolution that your video is putting through to something that will not hinder your audio, and that's something that your network can support. That said, if you are noticing issues with trying to push too much video through, where your video looks pretty good, but your audio or your other experience is not great, look in your device settings for your platform. A lot of times they have the ability to turn off high definition video, or they may be able to have a slider or something, some sort of setting in there to reduce the video quality so that you can potentially keep that audio better.
Okay, thank you, Jordan. So now we are going to move on to video conferencing hardware that has incorporated both audio and the video solutions. So one of the trends that we've been monitoring is the rise of the USB solutions that incorporate the audio, the video, and other features into a single device, which we commonly refer to as huddle space peripherals. So these devices are designed for small or medium conference size rooms, but they can also be used for clinical or group session encounters. Now, these technologies will generally have a built-in microphone and speaker solution. Oftentimes, they'll also have connectivity to another speaker. For example, if you have a long room that you need additional support of the audio solution. And many times these systems will also have a pan, tilt, zoom functionality. So now Jordan is going to provide you a brief demonstration of one of these devices the Poly Studio.
Thanks, Doris. So we wanted to give you kind of just a demonstration of what one of these devices kind of looks like and what it sounds like. So we've seen a trend for these all-in-one solutions. You get a lot of what I would describe as kind of boardroom video conferencing functionality in a USB plug-and-play type of solution. So if you're deploying something to a clinic space, a medium or large-size clinic space, a solution like this that combines the audio, the video, and some other kind of key features can be a good solution. One of the interesting pieces of technology that we're seeing embedded in a lot of these platforms is the ability to do active speaker tracking. And I'm going to demonstrate that for you here real quick. So a lot of these solutions are actually building in the functionality to locate and track a speaker inside of a room. So the camera is able to, depending on what direction my voice is coming from, kind of focus in on that direction and just change the field of view of the sensor so that we can actually see as I'm speaking. Some of these solutions will actually, if there's multiple people speaking in the room, they'll actually split it right down the middle and show multiple speakers speaking at once. So this kind of technology gives you a lot of that pan, tilt, zoom kind of functionality without you actually having to do it yourself. So solutions like this can make it easier to interact with your patient, actually move around the clinic space a little bit, and kind of have a better interaction without having to invest a whole lot of time in learning a new system. Back to you, Doris.
Okay, thank you, Jordan. So now the next thing that we want to share with you is a little bit of a few mobile peripheral devices. As we shared with you earlier in today's presentation, we are really seeing a movement towards use of mobile devices. Once again, we're a mobile society. We're using tablets, we're using laptops, and a lot of the mobile devices now are being designed with USB plug and play situations in mind. Also, some of the technology that's out there today in the mobile space is really designed to be used with a laptop or an iPad or a cell phone. And so now Jordan is going to share with you just a few of the mobile devices that are out there. Now, because of COVID too, we have seen an explosion of mobile devices, and this is great for us because it gives us an opportunity to trial new equipments. But right now, Jordan's going to share with you a few of the common ones that we see in day-to-day delivery of patient care.
Thanks, Doris. So we're going to talk about 3 different solutions here. And these mobile solutions run kind of a gamut of different use cases and different providers or individuals that we expect to use them. Kind of the only kind of common factor of these is they're all designed to work with a mobile device. So we're gonna talk to you about 3 different things. The first thing that we have here is the Echo Duo. So this is a trend that we're seeing in stethoscopes to pair to a smartphone. And to use that smartphone is actually the hub for the stethoscope. So using an Android or a Apple app, we're actually able to connect this Bluetooth stethoscope to the app and then send a link to a provider who can listen to steth sounds streaming over a simple web browser. So by using a mobile technology, we're able to actually stream without a whole lot of dedicated or specialized equipment. Another device that we've seen, or types of devices that we've seen really commonly hitting the market, are devices that are designed to be used by the patients in their home. So this is the TytoCare. You'll be seeing more and more of these kind of all-in-one types of devices. We really expect this to be something, especially as we are delivering more and more care to the patients in their home. We can expect to see more care like this. These are designed to be used by the patients in their home. They're designed to connect to the patient's Wi-Fi. There's guidance that's built into the device to walk them through how to perform a variety of different exams that are supported. There's some of the features on this one. It has a thermometer, it has a heart rate monitor, there's an otoscope tip, a soft otoscope tip so that parents can use it on their children. There's a stethoscope as well. So these types of in-the-home screening tools can provide a depth to your telemedicine platform that, or to your telemedicine services that you didn't used to have before. There's kind of two models for this right now. This is one of the ones that is purchasable through a big box store. A patient can go and actually buy this themselves. It's connected to a service. They take it, they do the exam, and then they send the exam off to a provider who can then call them and have an interaction with them. These can also actually be purchased for your clinic. So you can purchase these for your clinic and send them to patients and have that interaction tied back to your clinical environment. The last device we want to show for you today is something a little bit different. We're seeing, so this is the Butterfly, the IQ Butterfly. This is a portable ultrasound. It's a point-of-care ultrasound that connects to a smartphone. And with the smartphone app, you're able to change between a variety of different modalities. You're able to add Doppler. You're able to change the focus settings and run it through a variety of different test settings. These types of devices, being able to connect to something like this to a mobile device and being able to send that directly from the mobile device really gives you a chance to use some really common, again, not specialized technology to really get a different kind of point of care functionality that you didn't have before. We've got a quick video that we can show this device in action.
This is a demonstration of the Butterfly mobile ultrasound. The ultrasound footage was recorded from inside the Butterfly app on an iPad. Using the vascular access preset and the color Doppler setting, we are able to visualize arteries and veins within a subject's forearms. This demonstration shows that mobile tablets are becoming robust telemedicine platforms, able to support a variety of peripherals and workflows.
So due to the time, I'm going to move through these last few slides fairly rapidly. These are things that we talked about a little bit before, but we just wanted to remind you that as we are engaging patients in the use of telehealth, this is possibly the very first time that these patients have used technology to seek clinical care. So we really want to make sure that we are flexible and that we're compassionate with them as we're moving into this new environment. As we said before, we will be using their technology, their tablets, their cell phones. So we want to make sure that we have a plan in place so that if something happens during that clinical encounter, that they know that we have planned for that. So for example, if you can trial with the patient before you have your clinical encounter, that would be wonderful. If that isn't available to you, at least, when you're beginning that clinical encounter, ask them for a phone number that you can call them back should something happen to your connection. That way, that provides, a little bit of ease of use for both the provider and the patient in knowing that you have developed a plan. As we said, test and prepare as soon as possible, and practice your website manner with these patients. So we want to make sure that everyone feels comfortable when you're using telemedicine and that the technology is as invisible as possible during that experience. So some key thoughts as we close out this presentation to you. The technology should always support the use case. Identify the type of clinical services that you want to provide first, and then go out and choose the technology. Make sure that you trial the technology before you buy it. Many vendors will allow you up to 30 days to try their technology, and we really recommend that you do that, because if you don't, you may find that you have chosen a technology that isn't usable for whatever reason, and it ends up just collecting dust in a drawer. You also want to make sure that you have the support from the clinicians, the administrative team, and the technicians. You really want your clinician to try that technology before you purchase it. You may find they don't like it, and if they don't like it, they won't use it. You also want to make sure that your administration has bought in and that you've included your technologists. I know many times we've heard the horror stories that organizations have chosen very expensive technology and the IT staff wasn't involved, and then they've been brought in on the back end to try to make this system work. So we want to make sure that we don't do that. With regards to COVID-19, as we stated earlier, we are using this technology now to provide services to the patient in their home environment. We're also using this technology to allow the provider to provide this service in their home environment. So that brings on a whole other world of issues with regards to the connectivity, the broadband issues we've talked about, and the security and privacy associated with providing these services outside of your clinical environment, your normal clinical environment. We also want to make sure that we're planning past the crisis, right? The technologies that you are choosing today need to be the technologies that you are going to have in place or keep in place a year from now or 5 years from now. So even though you are planning for a current environment, please be thinking about how this technology is going to be used by your environment going forward. So how can you get a hold of TTAC? You can get a hold of us on our website. We have a request technical assistance form that you can fill out, and we will respond to your questions that you have. Or you can call us at our phone number 844-242-0075. So at this point, Jordan and I would like to thank you very much for giving us the opportunity to share technology with you. It's our passion. We would be glad to answer any questions that you might have at this point.
Thank you, Doris and Jordan. That was fantastic. If we could go back to the panelist view, great. So thanks to all of you putting in the questions in the Q&A. We have a really rich blend of things. Let me just first do some level setting and ask both of you to comment on, you gave us telehealthresourcecenter.org as well as telehealthtechnology.org. How would you invite participants to use your websites? Start with Doris.
Well, both of our websites have an interactive Q&A survey that they can ask. Now, the National TRC, what they primarily do will drive you to whichever TRC is either in your region, or if it's a technology question, they will drive you to TTAC. And so then TTAC will receive that, and we will contact you. So either way, if you're either on our website or on the NCTRC website, we will get a form and we will respond to you. Oftentimes what we find is that it isn't just one person in an organization that is seeking information. So a lot of times Jordan and I will set up a Zoom call so that we can get a number of people into that response. So we will receive it via paper or through the internet, but we will respond to you in person.
Great. Anything to add to that, Jordan? You're on mute, Jordan.
Happens to all of us. The other thing that I'd add to that is our toolkits. So if you go to the telehealthtechnology.org, you can check out our toolkits there. Some of the key ones are, we have one called a Clinician's Guide to Video Platforms, and that's really helpful for providers that are looking to kind of gauge what they need to deliver care. We've also put there's a lot of things about specific equipment, how to assess specific equipment, how to assess equipment in general. So our toolkits are a really valuable resource and a good place to start if you're wanting to get up to speed on a technology quickly and you're not quite sure where to start.
Great. I'm going to do some rapid fire here so I can give May a little section at the end to close things out. But there's a question about, how do I assess how good my own bandwidth is? Is there a tool for that, Jordan?
I would start with the speedtest.net is kind of a good place to start. And I would do a couple things. One is just run the speed test. It should give you an idea of your broadband, but realize that it varies based on time of day and kind of depending on your connectivity, what your neighbors are doing, might affect it as well. So run a speed test. Speedtest.net is generally kind of the accepted one. And then maybe run it at multiple times a day and kind of graph that out and see how does your bandwidth change from one time a day to another. Do you get a big clamp down on connectivity when your kids are connected, things like that. So that'll give you a sense of what you're actually getting to your wall.
Great. I want to maybe one or two more questions. I want to acknowledge there's some questions about specific issues that will be covered in future sessions. So there's quite a few coming in about adherence to ADA and accessibility. There's a couple of questions about legal issues, and we do have dedicated sessions to those in the future. One or two more questions to finish up. This comes from Kristen Korinko about, have you come across any potential technology grants for providers, families, or small businesses? Doris, any visibility into that?
Well, there are a few grants that are available for providers, and one of them right now, when you're looking at specifically technology, is the one through the USDA. And usually what we see is that with the new fiscal year, federal fiscal year, that started October 1, we are probably going to see the grant cycle start in about December, January, February. So if people go on grants.gov, they'll be able to search any kind of federal grants that are available to them. Then, of course, you're going to want to look at foundation grants in your region, or even, one of the things that we have been seeing is as you implement telehealth into your service delivery system, you are saving your healthcare providers money. So you may want to look at Blue Cross Blue Shield or other healthcare providers. They also may have foundations that that you can apply to receive dollars for delivery of telehealth.
Great, thanks. And I think one more question, and then I'll throw it back to May to close things out. This comes from Susan Konati Buck, and it is, how can we be sure that the vendor is meeting requirements for TEFCA and data interoperability?
Yeah, so what you'll find is when you talk to vendors about interoperability, they will all tell you that they're interoperable. But what you find is that you're going to learn what exactly they mean by interoperability the more that you kind of engage them with specific requests. So what I recommend to anyone that is concerned about interoperability is to kind of have the elements that you want to make sure get into or out of your EHR defined before you start to approach a vendor, and ask as specific questions as early as you can, and they will be able to talk to you about their interoperability. The other thing to think about is as you approach different telemedicine vendors, a lot of them already have pre-existing relationships or have done pre-existing development for one EHR or another. So ask on the front end, do you have a lot of ties with Epic? Do you have a lot of ties with Cerner? Which EHRs do you work with? Which EHRs do you have a lot of this functionality already built?
Great, thanks. I'm afraid we have to cut it short there. I just want to thank Jordan and Doris for a great introductory session to this series. I'm going to put one last web address in the chat, just really to drive you to your own local TRC. I just went on the websites during the webinar. There are great web forms where you can literally put your specific question right in there. So let me throw it back to May to close out the session. Thanks for everybody's attention.
Thank you, Dr. Reimers, and thank you, Doris and Jordan, for this excellent presentation. The compliments have been flying in the chat if you haven't seen them. So a couple of questions did come up that we weren't able to answer. So we will download the Q&A and try to get to those questions as well, which was why it was important that you use the Q&A function. But upcoming sessions may also answer the questions that some of you had. So on October 26th, which is just a few days from now, we will be having a session discussing telehealth and the interaction with the ADA, the American Disabilities Act. And we'll have on our panel actual providers who have utilized telehealth to provide services to people with disabilities, and also the Department of Justice will be speaking as well. So you will find the registration information on the TRC website where you can sign up for that. And also in November, we will have a mini legal series as well that will talk about various legal issues that probably quite a few of you have questions on around licensure and patient-provider relationship, liability, and privacy. So those are the upcoming webinars that we have for the HAC. Once again, I want to thank Doris and Jordan for that excellent presentation, and also to thank Dr. Ramers for his wonderful facilitation. Thank you, Dr. Ramers, and thank all of you for attending today. I hope you found this useful. There will be an evaluation coming out to you within the closing of this webinar, so please fill that out. That'd be very helpful to us. Know that the recording of this webinar and the PowerPoint will be available within about 24 to 48 hours on the National Consortium of Telehealth Resource Center website. Thank you again, and I hope you have a great afternoon.